Hi, this is Steve Sharp at Esteem Therapy Yorkshire. Welcome to part 2 of Module 4, where I'm going to give you more powerful tools to use in breaking your addictive patterns. These tools comprise my Midas toolkit for achieving full recovery from sex and porn addiction. You can find out more about this in my written Module 4 on my website. In particular, in this module, we will be looking mostly at how to use the simple yet hugely effective technique of distraction. We will also look more briefly at the idea of reward and how this can be put to great use in attaining recovery from your addiction patterns. I quickly want to recap some learning points from previous modules. Firstly, you as a sex addict will be using the behaviours as a form of self-soothing, and repeated use over the years will have trained part of your brain to repeat the behaviour automatically without obvious triggers. This we might call a form of dopamine dependency, set off by even the tiniest opportunity signals, such as being in a certain place or a partner saying, "I'm going out." Secondly, willpower alone is not enough to fight this dependency, as once the dopamine tap is dripping, it is hard to turn back. A point of no return, in other words. Thirdly, and following on from this, is that tools and techniques are essential in breaking the pull of addictive urges, and that discipline is required to retrain your addict brain. So I'm going to help you adopt some techniques to infiltrate this Pavlovian-like pattern and disrupt it enough to put you back in control without having to white-knuckle cravings with flaky willpower. I'm going to call your addictive pattern a ritual, in the sense that you are continuously performing the same set of actions over and over in a prescribed way. Within your ritual, there will always be decision-making points, or we could call them deal-breaker moments, or DBMs. These will be there at several stages of your ritual, and the earlier you spot them before the point of no return, the better. As an example, if your ritual involves visiting sex workers, the DBM is present as soon as the thought occurs that you have the opportunity, or it could occur whilst you are looking online for a venue, or it could occur on the way to meet someone, or even ringing the doorbell. Often the DBM is signified by an internal dialogue along the lines of, "I want to," "No, I shouldn't," "I want to," "No, I shouldn't." Spotting the DBM is done by developing a mindfulness approach. As discussed in previous modules, this can be used to switch from unconscious robotic behavior patterns to a more self-aware state where rituals can be mentally slowed down and worked on. At this point, one of the most powerful and effective techniques known should be applied: the instant distraction. Instant because it should be switched to as soon as the DBM is noticed. No consideration or debate should be entertained in the mind. The only thing to do is take action. Now you are changing behaviours. Talk to someone about the weather. Change your shoes. Walk around the block or to a shop. Cook the dinner. Do the ironing and so on. It doesn't matter if the distraction type is mundane. Its value is in keeping you safe from self-destructing. Keep distracting until the opportunity goes away. Let's take this to the next level. Being mindful of upcoming opportunity triggers is probably the second best technique to adopt in the early stages of recovery. If you know you are going to be alone for a specified period, or in a certain place where acting out is possible, and so on, then a planned distraction can be set up. Getting a number of more involved tasks or recreations planned in, such as a decorating job or going for a hike or visiting family, means more distraction, safety, and mental retraining will be completed. My clients report good levels of success with these two techniques, instant and planned distractions, so they can get to a month or 6 weeks of abstinence with little effort. This is really critical to recovery, as for many, this is enough to claim back sufficient control over the dopamine cravings and begin to feel more confident about the recovery journey. One final point here on the distraction techniques is that because addiction takes up addicts' spare time, they have not been able to nurture more healthy and fulfilling ways of using their leisure time, such as hobbies, interests, and passions. However, if these are present, they offer excellent opportunities for distracting self from addictive rituals. Distractions are at their most powerful when they have a special appeal. The next training stage for a marathon, or painting the finished scale model, or improving a golf swing, and so on. If hobbies and interests are missing from your life and you're lacking inspiration, please email me and ask for a free set of distraction cards which contain over 120 ideas for forming good habits. In the final part of this module, I want to introduce you to the idea of positive and negative reinforcement and how this can be used to great effect in recovery. A positive reinforcement is when a behaviour is rewarded, such as getting a gold star for doing good homework, or receiving a bonus at work for achieving your targets, the adult version. Negative reinforcement, on the other hand, occurs when behaviours lead to a punishment or withdrawal of privileges. You can use this idea in several ways, which we'll develop further in the next module. The first way is to note that some unhealthy or bad behaviours appear to positively reinforce. This is true of those in sex addiction. The pleasure produced by sex is both healthy and calming. So with sex addiction, whether behaviours are unhealthy or bad, there is an appearance or illusion of pleasure or calming. My clients report this as very short-lived, or even non-existent. So the first rule here is to question and challenge the illusion that sexually compulsive behaviours are enjoyable and rewarding. This is one very deceptive way that the addict brain guards its dopamine supply, so it's good to quash these assumptions early on. Linked to this is to consider and write down the negative consequences of your sex addiction. You will be shocked at the long list of harmful impacts your addict brain will have been denying for a long time. Damage to your self-esteem, the weight and isolation of shame, the impact on your relationships and sex life, the loss of jobs and harm to reputation, and so on. Seeing and revisiting regularly this list of harmful effects will counter the addict brain's lie that this is fun. Now list the positive rewards that will accrue from recovery, as these will help to shift your resolve more towards recovery and also lessen the power of cravings from your addict brain. From having more time and energy and raised self-worth to the rebuilding of trust from partners and fulfilling ambitions, not to mention saving money and feeling less anxiety and worry about being discovered, less chance of catching an STI. Regularly thinking about these benefits will inspire you to continue towards recovery. That brings us to the end of Module 4, Part 2. I hope you will join me in Module 5's audio available soon. Thank you for listening.